Good morning. Today we'll be talking about diabetes care in lean and uncertain times, which certainly these times are right now. We have Drs. Isiavwe and Drs. Korubo here to talk about diabetes care. But first, we would like to just have Mustafa of the KB Club College of Medicine, University of Lagos, come and talk to us about a very laudable project that they are holding right now. So Mustafa, can you tell us, what is it that the KB Club is up to at the moment that you want to share with Lagosians this morning?
Hello, good morning, everyone. Thank you very much, Dr. Pamela. My name is Mustafa Madeni, and I'm a fourth-year dental student at the College of Medicine, University of Lagos, and I'm also the General Secretary of the KB Club College of Medicine, University of Lagos. The KB Club College of Medicine is going to be hosting a voluntary blood donation drive, which is themed Your Power to Give Life. This blood donation drive is aimed at two things majorly. First, we are looking to improve attitudes towards voluntary blood donation, and we're also looking to reduce blood shortage significantly through our own little means by raising 1,000 pints of blood in a day. We're working with the Lagos University Teaching Hospital, Department of Hematology and Blood Transfusion, the Lagos State's Blood Transfusion Service. We're also working with Nigerian Red Cross Society, the Lagos State chapter, and we're doing this through the power of collaboration and through the will of impact to raise 1,000 pints of blood in a day in the University of Lagos Sports Center on Friday, November 17, 2023.
So what do you want people who are listening to do?
We want everyone listening to, follow us on our social media platforms, KB Club, across all social media, to keep up with us, keep up with our updates, and to ensure that they prepare to come around on Friday, 17th November 2023, at the Indoor Sporting Complex, University of Lagos Sports Center, to come around to donate voluntarily, to voluntarily donate blood to save lives.
At what time would you like them to be there?
So this program will be running from 9 a.m. on Friday, 17th November, through till 6 p.m. through to 6 p.m.
Thank you very much. Also, we'll hopefully remind people, please join them on this Friday, at between 9 and 6 at the University of Lagos Sports Center. Thank you very much. Dr. Isiavwe, it's a pleasure to have you with us once more, and Dr. Korubo as well. Thank you for coming on the program. We're talking today about diabetes care in lean and uncertain times. We think most people know what diabetes is, but Dr. Isiavwe, can you just kick off telling us what is diabetes and why are we talking about this care at this particular time?
Thank you, Dr. Pamela. Good morning, everyone. Diabetes is a chronic condition. When I say chronic, I mean something that is lifelong and is characterized by poor blood sugar control. The classic symptoms are frequent urination, increased thirst, weight loss, which are the classic symptoms, but in about majority of the people that would have diabetes, these symptoms are usually very subtle or not present. So it's not enough to rely on the symptoms for diagnosis. And diabetes is important because if not well managed, it can give rise to several complications.
Now, talking, Dr. Korubo, about lean and uncertain times, what do you think? Talking, Dr. Korubo, about lean and uncertain times, what do you think about what people are going through today?
Thank you for having me. It's always a pleasure to be on this. I think one of the first things here is when people are living with diabetes, so our terminologies continue to improve. So we no longer use the word diabetic. I actually say people are living with diabetes. When people are living with diabetes, this condition affects the individual. it affects the family, it affects the community, and then, of course, the state and the nation as a whole. And so care for diabetes would involve clinic visits regularly, drug prescription tests, and then, of course, the part at home. Now, all this would affect the finances of a patient. So there's the direct finance of the cost of seeing a doctor, the cost of buying your drugs, the cost of doing investigations. And then there's the indirect expenditure of time out of work and all that. And, you know, at the end of the day, most people would say that on the average, patients would spend nearly 40 to 50,000 a month, and the minimum wage is 30. So you can imagine the point that for people living with diabetes, they have a 20,000 naira deficit every month just for drugs alone. You haven't mentioned other key things. So people are going through a lot. It's a difficult time for many people. And at the end of the day, this reflects how they care for themselves. So now you have people skipping clinic visits, not doing the tests they ought to do, and actually rationing drugs the wrong way. So somebody's taking a pill 3 times a day. He's taking that pill once a day so that he has enough to keep him for a month. So people are going through a very tough time.
Now, Dr. Isiavwe, this World Diabetes Day is talking about knowing your risk. That's what the World Diabetes Day is about. So how important is it to know your risk at this time? Because some people would say, you know what I don't know can't hurt me. Let me not go and, you know, as they say, let sleeping dogs lie. You know, there's so many things that says, let me not know, even if there's a problem, let me not know it now, because I don't want to end up in the basket where I know I have diabetes. And then, you know, I now have to face this 50,000 naira bill per month. What do you say about it? Is it still important at this time to know your risk?
Extremely important to know our risks. There's a popular saying that goes, to be forewarned is to be forearmed. So for diabetes, it's important to know your risk so that if you're at a high risk, you take decisions to reduce your chances of coming down with diabetes. You change your lifestyle, you change your habits and all that. And then if you're already living with diabetes, you do the things that will make sure you don't come down with the complications, the unwanted complications of diabetes. So risk assessment is important.
So how do you set about it? What are your recommendations for people? Let's start off with knowing your risk before we go into the actual diabetes care, which Dr. Korubo has already started talking about.
So first of all, knowing your risk, we have what we call modifiable risk factors and non-modifiable risk factors. So non-modifiable risk factors are what you really cannot do anything about. Having a family history of diabetes, getting older, as you're older than 40 years and above, you're on treatment for hypertension or cholesterol, or you had gestational diabetes, you really can't do much about those. However, if you're sedentary, if you're overweight, if you have a bad diet, those are things you can address. And how do you go about testing? So if you have a family history and you're already older than 40, it is recommended that you should keep a close eye on your blood sugar, especially if you're sedentary or overweight. So different bodies have different recommendations. But in a resource-poor environment like ours, I would recommend once you are overweight, you have a family history, your risk is high. Actually, the International Diabetes Federation has a risk calculator. So if you go online to their website, you can look, you can calculate, and if you're high risk, then you should be checking your blood sugar at least once a year. If you are less than 40 years old, non-obese, no family history, then maybe like every 3 years or something like that. But we know it's commoner, especially type 2 is commoner as people tend to age greater than 40 years old. So once you've crossed that line, you should be checking every year.
Well, I think that's so important to know your risk, and it's something that I think we'll try and see how we can put a link on our Doctors on Air website for people to the diabetes. What could you repeat where that link is? So people
The International Diabetes Federation. The International Diabetes Federation. There's a risk calculator there. So you can link there, and it looks at your age, looks at your weight, family history of diabetes, your lifestyle. Do you eat vegetables and all those things? Are you on treatment for hypertension? So, and then it will let you know if your risk is low or
give you an
high.
idea of what it is that you're doing and how it is you should set about it. I think that's such a critical point. And also, I think also you were talking about testing. Some people might like to know, is it just the glucose they should check if they're doing their annual check? Is it just the annual, glucose test? Should it be the random test? Should it be the HbA1c? Could you just tell them what kind of test they should be doing?
So there are different tests available for assessing your risk for diabetes. I know in the UK, that's far from here, but once you are more than 40 years old, they tend to use the HbA1c, which is more sensitive. You can do your fasting sugar, which is you would stay without food for like 8 to 12 hours and go to the lab in the morning. You can do a glucose tolerance test, which is you come in, they give you a glucose mixture to drink, and then they check your blood sugar at intervals. This glucose tolerance, we usually do for pregnant women to pick up gestational diabetes. And then if the random blood sugar is high, more than 180 milligram per DL, and you have somebody who is symptomatic, having the classic symptoms, you can also make a diagnosis of diabetes. So there are several things that can be used for screening, several tools.
Thank you very much. So Dr. Korubo, we've been talking about the need for diabetes care in lean and uncertain times. What would you say is very important, a critical aspect of this that you would like our listeners to know about?
Well, I think that I would like us to know at least 4 simple things. The first one is that to care for a patient living with diabetes, it requires a multidisciplinary team with the patient at the center. So what this means is that the decision to be taken to care for somebody living with diabetes, the patient's family members must be part of that decision-making process. That's the first one. The second thing I'd like the patients to know is, while we have cutoffs for diagnosis, each patient has specific numbers unique to them. What that means is that if I am living with diabetes, I would have specific numbers for me, what my fasting should be, what my blood glucose should be after meals, what my HbA1c should be. So it's individualized. And as a patient, you should know your numbers. That's very key. The other thing I'd like the patients to know is that the care for patients living with diabetes is divided into 2. There is a clinical care. When you come to the hospital, what the doctors should do. And in that clinical care, it's important that patients insist that the doctor examines their feet. So it's your right to say, doctor, I'm living with diabetes, please take a look at my legs. And then I want the patients to also know that there is home-based care. Now, for the home-based care, we have an acronym, M, monitoring. So patients are taught to take their blood sugar measurements and record. First E, examine their legs. They are taught to examine their legs. The second E, exercise. Exercise that is recommended, prescribed for them, looking at their holistic health status. Then there's a D, which has to do with diet, taking the right diet as told. There's another E for education, and finally, medication. So just to note that home-based care is key. The acronym is MADEM, M-E-2-D-E-M. Thank you.
Oh, thank you very much. That's very useful. Dr. Isiavwe, When we talk about care in these lean and uncertain times, what is it specifically you want people to be thinking about?
I want people to consider getting health insurance instead of paying out of pocket. At the end of the day, if you have a good health insurance plan, it will take the bite off your finances and would make sure you continue to access care. I know Lagos State has its Ilera Eco that you can access diabetes care. For the private health insurance companies, if you're not on a corporate plan, if you're on an individual plan, some of them would expect you to have a wait period, like 1 year wait period before accessing chronic care. So while you're getting health insurance, please find out if you can access diabetes care. In addition, if you have to pay out of pocket for your medications, you can consider getting generic options. That's the non-branded medications. They are less expensive, but also
where?
effective.
I want to jump in and say where.
Oh,
where can they get safe and effective generic medication?
At your registered pharmacy, the neighborhood, the registered licensed neighborhood pharmacy. We have a lot of brands. I don't want to mention brands now as we're on air, but we know that there are good pharmacies that stock safe and effective generic medications. And then when it comes to blood glucose testing, instead of testing every day, there's something we call head testing, which can be done like about 2-3 days before your clinic visit. So you can decide to check your blood sugar 7 times a day for like a day or two to your next specialist appointment. You check fasting 2 hours after breakfast, before lunch, 2 hours after lunch, before dinner, 2 hours after dinner, bedtime. That would help give us a better picture of what your control is like, instead of just checking once a week or once in 2 weeks. So there are ways you can adjust your blood sugar testing to reduce the number of test strips you would use in a month.
Okay, thank you. Thank you very much for that information. Now, one of the things I'd like to just ask about, because people are interested in, is if you have a family history of diabetes, you haven't got diabetes. There are these levels that they say it's pre-diabetic, you can do something about, you can eat right. How can one who knows they're in a situation that has a family history prevent themselves from getting diabetes? Because at this time, really and truly, no one wants to get it. What can they do? Dr. Isiavwe?
Okay, so primary prevention. First of all, your fasting blood sugar should be less than 100. If it's more than normal and even not yet in diabetic range, that is in itself is a problem. Activity. A lot of people work in the offices, they sit for hours on end. So you need to get moving if you have a family history of diabetes. At least 30 minutes, 3 to 5 times a week, 30 minutes of continuous activity. Your diet is important. Vegetables, less carbohydrates and all that. So exercise, diet, and then look for how you can lose weight to reduce your risk of, reduce your risk of coming down with diabetes or delay your getting diabetes.
Thank you, Dr. Korubo. Going to you now, there's so many people who unfortunately haven't even told their family members that they have diabetes. For some reason, there are still people in Nigeria today who don't tell their family they have diabetes. So the family don't even know they're at risk. What do you have to say to them?
Well, I'd just like to say that there was a time when people were stigmatized for living with diabetes. The stigma spanned from the family up to the office place, and at the time you couldn't even get insurance if you know you had a diagnosis of diabetes with complications. Times have changed today. It's very important as a family member, if you're living with diabetes, that the rest of your family knows. This would help them know that the risk is there in the family, and this would help them take active steps to prevent diabetes. And you know, sometimes you have a family relation that constantly comes asking for financial aid, but he doesn't really open up. And if people know that look, you're living with diabetes, they could step in. We've had experiences where you have patients that have diabetic ulcers, and unfortunately, it's gotten to the stage where we need to take legs off. And the family members come in, and the first thing they think of is juju and all that, basically because they were not even initially aware that their brother or sister was living with diabetes. So I think it's a very important thing that you let your family members.
Thank you. And in terms of the food, a lot is being written, particularly in the social media now, about how you can actually reverse diabetes using certain diets. What would be the optimum? Some people say, you know, as a diabetic, you shouldn't eat carbohydrates at all. The nutritionists are giving wrong advice, you know, but and some people are doing very well, coming off medication with low carbohydrate diets and so on, and switching to, you know, good sugar alternatives like stevia, etc. What would be your thoughts on this?
Okay, I think the first step to state here is that the term diabetic diet does not exist anymore. So there's nothing like a diabetic diet. What we advocate is a balanced diet that is nutritious, tasty, available, affordable for that individual. So that's the first step. Now, the second step is that the diet has key ingredients, the nutritional content. So the diet should contain carbohydrate, yes, should contain fats, yes, and should contain proteins. And standardly, we have a percentage proportion. So carbohydrate actually should make 50 to 55% of diet. That's shocking for most people. Fats should be about 30% and proteins 20%. So the content matters for the diet. The other thing to note here is portion control. So we have nice plates now that we can use to show patients and tell them about, you know, what each content should be. Now, if you permit me, I'll show you something very simple. One, if a patient is to eat a staple food, say unripe plantain flour, for example, or amala, this quantity for the patient is the size of the feast. So my size of the feast is my quantity, and your size of the feast is your quantity. The soup and all that should be the size of the palm. Protein should be in here and fats here. So there are simple ways we can do apparent measurements to ensure that patients eat right. This other topic, if you will permit me, is the concept of remission. So when the patient is, you know, diagnosed with living with diabetes, and then it's reversed, remission. Now, this is key, and yes, we promote remission for patients living with diabetes, but it is not for every patient. So there are criteria. For example, the patient should have been diagnosed within the past 6 months or 1 year. The HbA1c should have been a particular value and all that. So remission is very possible with diabetes, but it's not for everybody. The misconception that people living with diabetes should not take any form of carbohydrate is completely wrong. And the ketogenic diet itself is known to cause a lot of harm to the patient. So I think that the right knowledge is important. Thank you.
Thank you so much. Now, unfortunately, time has, you know, run out on us. So do you have any last words for our listeners? Dr. Korubo.
Well, just to say that diabetes today offers an opportunity. If you follow all the steps to care for yourself while living with diabetes, you will end up living longer and better. So rather than being a limitation, diabetes may perhaps eventually be an opportunity.
Thank you. Dr. Isiavwe, any last words for our listeners?
Yeah, diabetes is not a death sentence. It's a wake-up call to have a healthier lifestyle. And with a healthier lifestyle, you can live and live well with diabetes. Thank you.
Thank you very much. And just from me, please remember, one and all, please go over to the University of Lagos Sports Center on Friday the 17th, anytime between 9 and 6, and be a hero. Donate blood, save lives.
Thank you for watching. Please like, share and subscribe for new video updates.